Good morning, everyone. I'm going to present a paper on evaluation of 250 patients with optical coherence tomography for screening of retinal pathologies prior to cataract surgery. So cataract is one of the most common causes for visual loss in adults, and cataract surgeries are the most commonly done ophthalmic surgeries around the world. So routinely, a fundus examination is performed before a cataract surgery by microscopic fundoscopy, but subtle macular pathologies may be missed, which can be a cause of postoperative low vision. And these subtle pathologies can be easily picked up by an imaging technique, that is a spectral domain optical coherence tomography, which allows for a detailed cross-section of the macular region in the presence of a media opacity like that of a cataract, or in case of non-dilating pupil. As the OCT has a potential to improve the preoperative diagnostics in patient prior to cataract surgery with considerable impact on further therapy. So aim of our study was to assess the screening benefit of the spectral domain OCT as a part of routine preoperative evaluation in cataract surgery to detect any macular pathology. It was a retrospective study in conducted in patients who underwent cataract surgery at a tertiary eye care center, and 250 eyes of patients were selected. And the study period was 6 months, and the data was collected from the electronic medical records of patients, which included the patient's age, gender, systemic status, the grade of the cataract, and the preoperative spectral domain optical coherence tomography, 3x3 volume scan, the line scan centered to the fovea on Hilberg spectralis. We included patients with significant cataract haze with an apparently normal fundus on indirect ophthalmoscope, on an exclusion criteria in mature cataract, and patients who were already on follow-up for any retinal pathologies. Coming to the results, the age of the study participants ranged between 29 to 85 years with a median age at 70 years. And most of the patients had nuclear sclerosis cataract, followed by posterior capsular cataract, and followed by cortical cataract. And among the 250 eyes, we could see an OCT abnormality in about 68 eyes, that is about 27% of the patients. And the different OCT abnormalities included, most commonly it was drusense, followed by vitreomacular traction about 11%, and 8.8% of epiretinal membrane, vitreomacular adhesions, and about 4.4% of posterior vitreous detachment, and 25% patients had other findings which included pigment epithelial detachment, foveal contour flattening, retinal pigment epithelial changes, and microaneurysms. So these are the subfoveal drusense. There's an epiretinal membrane with a pseudo hole. It's a vitreomacular traction with an intraretinal cyst, and this is a posterior vitreous detachment with a foveal contour alteration, which cannot result in a reduced post-op visual acuity. And the post-op visual acuity in patients with the OCT abnormality, we could see that the visual acuity improved to 6.6 in about 58.8% of patients, but visual acuity remained less than 6.6 in about 41% of patients, and among the 41%, the visual acuity improved to 6.9 in 78% of patients, about to 6.12 in 7% of patients, and about 14% of patients had a visual acuity of 6.18 postoperatively. The OCT abnormalities with visual acuity less than 6.6, most common again was drusense, followed by vitreomacular traction, then vitreomacular adhesions, epiretinal membrane, and posterior vitreous detachment. In 41% patients with post-op visual acuity less than 6, and active intervention was taken for about 15% of patients, and among them 10% underwent vitreoretinal surgery for epiretinal membrane and vitreomacular traction. Coming to the discussion, our study included 250 eyes, and about 27% of them had OCT abnormalities, with drusense, that is age-related macular degeneration, being the most common, followed by vitreomacular traction, followed by epiretinal membrane, which was similar to all studies like Carbacos et al., Moreira et al., and Klein et al. And they all concluded that optical coherence tomography was more effective than indirect ophthalmoscope to detect subtle macular pathologies. To conclude, the preoperative OCT was able to detect subtle macular pathologies which remain undiagnosed during a routine dilated retinal evaluation. An active intervention was taken for about 15% of patients with OCT abnormality, and we could explain guarded visual prognosis to a higher percentage of patients. The progression and stability of the pre-existent retinal pathology was able to be monitored, and we were able to make patient aware of the visual prognosis to overcome any possible litigation or unhappiness to the patient. So the suggestion that we put forward was preoperative optical coherence tomography screening can be performed prior to cataract surgery to enhance the patient's visual prognosis. These are my references. Thank you.
Very good slides. Actually, we have been telling this since yesterday again. The slides have to be better. It has to be in brighter colors. And yeah, this was a really good presentation. And all these can be almost clinically found, right? Why do you need OCT?
In patients with significant cataract haze, in that ophthalmoscopy will be difficult to see the fovea and the macular region.
Okay.
So OCT can detect these macular pathologies which can be missed in
But you have
significant
excluded mature cataract. So
Yes.
you mean to say like brown cataract?
NS3,
3 to 4,
NS4,
NS 3 to
PSC
4.
cataract.
Okay. And do you know how much does OCT cost for a patient?
2000.
Is it so?
1000.
You should know when you're doing a study, because the cost factors are also important, because you are doing too many investigations for the patient, basic blood investigations, a scan, and so many things are there. So that cost factor also has to be considered. Okay. Only 15% needed active intervention, right?
Yeah,
So is it worth doing OCT for all the patients? That is my question.
we were able to make the patient be aware of the retinal pathology in case the
For
visual
our own
acuity-
safety, right? Okay, good.
Very good, and
Good.
the idea is good. But you remember, no, 60-70% of the cases are camp and free. So maybe for hospital can manage. Basically, the cost is nothing. So that is good, fantastic study. But you mean to say majority of the drusen were not clinically detectable?
No, it was detectable, but we could differentiate the drusen's which could affect the visual acuity.
Only for premium IOLs, multifocal, toric, they do it as a routine because expectations are high and it charge 1 lakh, 2 lakh, and so on.
Yes.
That's okay. Another thing, you said commonest ophthalmic surgery in the world is cataract. Correct or wrong? Anybody? Commonest surgery in the world done on the human body, not only ophthalmic. Okay, commonest, we do 17-18 lakhs in India alone. Good, man.
Thank you.